Welcome back. We're talking with Dr. Sullivan of Oakdale Animal Hospital out on Highway 471 in the Reservoir area. Thank you for talking to us, Dr. Sullivan.
Sure, Elizabeth.
We're wanting to share with the community the importance of proper vet care and what you need to do to take good care of your pet. What are some of the basics that we do on basic animal care?
Yeah, some of the basic things are so important. Some of the biggest problems that we see are just missing the basics. So I'm going to go over some of the basic things that you do for responsible pet care. One of the first things when you get a puppy dog, especially if you start off with a young puppy dog or any age dog that you start with, get them checked out good. Make sure they're okay. Make sure they don't have any congenital abnormalities, any birth defects. Make sure there's not a pre-existing condition that we need to deal with right off the bat. So bring them by a veterinary clinic, have them checked out really well. Then they'll guide you in some of the other things that are basics. But here's some of the important things. Number one, to be well immunized. Many infectious diseases out there that are absolutely preventable. Kennel cough, Bordetella is a big one. And I know here and at many rescue leagues at ARF that upper respiratory diseases that are preventable are very important. Some of the older diseases like distemper are not as big of a problem anymore, but are definitely things we need to be vaccinating for. Many other things like parvovirus that are terrible gastrointestinal viruses, and of course rabies virus that we vaccinate for now in Mississippi on an every 3-year basis to prevent a disease that's very zoonotic. That means it's transmissible between people and dogs and people, and very important we stay on top of those vaccinations real well. Probably one of the most important things that we tell folks routinely, and it's really probably more important than vaccinations, is heartworm preventative. I mean, you're down here in the southeast, you are in the highest known area of heartworm infection in the United States, maybe in the world. But from Memphis to New Orleans along the Mississippi River Valley, it is absolutely terrible. In the last 3 years, I've been a veterinarian for about 20 years, and I have just seen an incredible explosion of heartworm disease. We need to be careful about the medicines that we're using for heartworm prevention. Not all of them are working well, and there's some that are working really well. So you need to be well versed in heartworm preventative. Give your heartworm preventative every month. There's an injection now that works every 6 months. So there's a lot of things available. Not forgetting normal surgical procedures after they've gotten to be 5-6 months old, having them spayed and neutered. Those are very important basic things that we do on a routine basis.
Most important to me is spay and neuter. I want to be out of this business.
There you go. There you go.
And a lot of people in the South think that a dog that is spayed or neutered is not going to hunt. And I get that a lot from people wanting to adopt a dog.
It's with me, you know, even with me, the veterinarian, when I had Labrador Retrievers, it was kind of oh, do I want to really neuter my hunting dog, you know? And we did, and many clients have neutered male hunting dogs, and it does not get rid of their drive. It just eliminates their sexually motivated behavior. If you neuter an older animal, it seems like you do have to watch their weight. You have to make sure their weight. We don't have as many problems if we neuter them earlier, before they're 5 and 6 months of age. Of course, spaying eliminates all the headache associated with being in heat every 6 months and tracting male dogs. A male dog, when they smell a female in heat, they're going to be going wherever they want to go. If they can get out of the fence, they will go through, over, under, around, however they can get out of that fence, across a busy road, you name it. And it's been the demise of many male dogs. But it also just as good, you know, animal gets out. You know, we don't, not every time can we keep them contained without fail.
That's true.
And they will get out, and they will inadvertently breed a female, and we'll have another litter on our hands.
And one unaltered male dog can make as many as, I think the number 28,000 litters, puppies in a year.
Many. It's exponential. It's like the pyramid effect.
Yeah, it's like a pyramid. Yeah. So, and that's a whole lot of animals that will need to be taken care of when we don't have enough people to adopt around the state. So, spay and neuter is very, very important.
And when we get these animals in, you know, there's just a lot of issues. They haven't been taken care of, and they'll have heartworm disease, and many, many other issues. And we can eliminate a lot of that by taking care of them well to begin with and getting them spayed and neutered and having good fences.
That's very true, very true. Talk about oral health for your pets.
Wow. Dental disease is probably the most common thing disease-wise that we see in a room, in an exam room. I mean, it is every day. It is probably the #1 cause in small dogs of some of the valvular heart diseases we see. When they have bacteria, that calculus, that white and gray and brown tartar that builds up on their teeth, in all sizes of the animals, but especially some of the smaller ones, builds up rapidly, and you have bacteria, you have nasty smelling breath. Those bacteria get in the bloodstream all the time. They're spread in the bloodstream. They love to go to the mitral valve in the heart. They love to cause kidney problems. They can spread to many different systems and create other problems. So dental health impacts many systems. It definitely impacts the length and quality of life. These puppy dogs have never had dental health before, and I see them in the room, and they have a heart murmur, and their teeth are falling out, and they have a lot of discomfort. I mean, it is probably the most common disease that we see, and you can have their teeth cleaned on a routine basis, do things at home, like feed them dental diets. They work really, really well. You can brush their teeth. I just don't think many people actually do that.
That's true.
Yeah.
They just don't think it's that important. They don't understand the
And it's hard to brush their teeth.
Yeah, I have one at my house that's not very fond of it.
Dental diets make it really easy, though. They'll help keep the teeth clean.
Okay.
Yeah.
Another thing that I've found that is very important, especially when people call me that they've lost their cat or their dog, is I'll ask them if the dog or cat has had their tags on them, and they'll say usually no, I didn't put them back on after I bathed them. And then I'll ask, do you have your pet microchipped? You want to talk about some microchipping your pet and how important that is?
Microchips are not really new. They've been around for a little while, and it's a permanent way of identification. And it is a small, almost the size of a rice grain, a little chip that goes underneath the skin. It's injected right underneath the skin, and it's in there permanently. And rescue organizations, sheriff's departments, veterinarians, all are equipped with scanners. And we really, really want everybody that has scanners to be willing to use their scanners when a dog comes in here. We scan the puppy dog, and it just tells us information on that puppy dog, and we can get the dog back to their owner. I don't care if they have a collar on them, any kind of identification on them. We can find out if they have that chip in them. And that works all over the United States. If they get lost in travel or anything, if you're at a rest stop and one of them gets out, it's pretty widespread across the United States, and we're able to use microchips real well. There's Home Again microchips, there's Avid microchips, so they're very effective.
I had a friend that had a dog that she lost it during Hurricane Hugo. The fence got blown down and the dog disappeared and she never saw him. And then after Hurricane Katrina, she got a phone call from a vet up in North Carolina, asked if she was missing her pet. And she said, well, I lost my dog 4 years ago. And he said, well, we got him here. The microchip works.
The scanners work really well as long as the people are willing to use them, and the rescue leagues and the sheriff's departments are willing to use them. The veterinarians have them there to use, and they work really well. A great retrieval system for these lost puppy dogs.
Thank you, Dr. Sullivan. Dr. Sullivan is at Oakdale Animal Hospital on Highway 471. They're excellent vets. We use them a lot. We're very appreciative of your time and talking to us about responsible pet ownership today.
Thank you.
We'll be right back.